Welcome to TRSC International LASIK Center. Those who have vision problems would realize how inconvenient it is to depend on eyeglasses or contact lenses on a daily basis. Wouldn't it be better if you could see things clearly with your own eyes? Let TRSC help you to improve your quality of life. Laser vision correction surgery is another alternative to improve your quality of life. Reduce your dependency on eyeglasses and contact lenses and eliminate vision limitations. Although there is a very low chance of having complications and side effects, it could occur. Therefore, we would like to provide you with as much information as possible about complications and side effects that may develop during or after treatment.
We, TRSC, suggest you to pay close attention to the information in our presentation so as to create the same understanding between you and TRSC. Unless you have sufficient information and accurate understanding, TRSC reserves the right to refuse the treatment. The cornea is the eye's outermost layer. It is the clear part that covers the front of the eye. It plays an important role in focusing your vision and consists of 5 layers. Epithelium. The epithelium is the cornea's outermost layer. Bowman's layer. The next layer behind the basement membrane of the epithelium is a transparent film of tissue called Bowman's layer, composed of protein fibers called collagen. Stroma. The middle layer is the stroma, which is the thickest layer of the cornea. It is composed primarily of water and collagen. Descemet's membrane. Behind the stroma is Descemet's membrane, a thin but strong film of tissue that serves as a protective barrier against infection and injuries. Endothelium. The endothelium is the thin innermost layer of the cornea. Endothelial cells are important in keeping the cornea clear.
At TRSC, we offer 4 options of treatments for vision correction. The procedure of these treatments is to remove the excessive corneal tissue and reshape the cornea to properly focus onto the retina for clearer vision. Our 4 options are:
the surgical instruments used in laser vision correction are as follows. The surgical tool to create a corneal flap. The surgical tool to reshape corneas. There are 2 techniques of creating a corneal flap. Microkeratome. A microkeratome is a surgical instrument with an oscillating blade designed for creating the corneal flap in LASIK surgery. The microkeratome creates 100 to 200 microns flap thickness. The patient may feel a heavy sensation and experience some discomfort during this part of the procedure. VisuMax femtosecond laser. VisuMax femtosecond laser can create corneal flaps with 3 to 4 times higher accuracy and precision than the mechanical microkeratome. This femtosecond laser can create 80 to 220 microns flap thickness. Most patients will not feel any pain or discomfort during this part of the procedure. Although the chance of flap complication with femtosecond laser is very small and lower than that of other methods, complications are still possible. There are 2 surgical lasers to reshape the corneas. The excimer laser has the following qualifications to reshape the corneas. A flying spot excimer laser emits a cool beam of ultraviolet light of a specific wavelength, typically 193 nanometers, to precisely remove corneal tissue. This excimer laser acts only on the surface it irradiates. The laser evaporates the selected tissue without generating any heat or transmitting the radiation to any other media. This process leaves no trace on adjacent tissue or elsewhere inside the eye. The excimer laser is used to reshape the cornea after the creation of the flap by either microkeratome or femtosecond laser. VisuMax femtosecond laser. The VisuMax femtosecond laser is a precision ophthalmic surgical laser designed for the creation of incisions in the cornea. The VisuMax accomplishes this by scanning tightly focused patterns of short femtosecond pulses of near-infrared light or laser in the cornea at precise and predefined positions and depths. Administration of continuous, focused laser pulses results in the creation of smoothly and precisely cut surfaces within the cornea.
Next, let's get into details about laser vision surgery that treats presbyopia or age-related farsightedness. There are two options.
Starting at approximately 37 years old, you may have begun to notice that reading and other near tasks are not as easy as they once were. Focusing up close becomes more difficult. Many people struggle to read a menu and are unable to read a price tag at a store without using reading glasses. Near vision surgery is a form of LASIK treatment for people with presbyopia or age-related near vision problems. Unlike typical LASIK surgery, only one eye is treated. This eye is given a small amount of nearsightedness for reading and near work. This will allow you to live a more carefree life without needing to carry a pair of glasses everywhere you go for simple tasks, such as looking at a menu. Near vision surgery can be categorized into two types. LASIK, laser in situ keratomileusis. It is a form of refractive surgery that involves the use of a microkeratome to make a flap incision on the cornea to the middle layer of the cornea. The flap is then lifted in order for the excimer laser to be used to reshape the cornea for vision correction. After the reshaping of the cornea, the flap is put back into place where it will adhere without any suturing. The cornea will heal on its own in a matter of days. Femto-LASIK or femtosecond LASIK. Unlike conventional LASIK, femto-LASIK uses a femtosecond laser to create a cornea flap instead of a microkeratome blade, making it a bladeless, all-laser form of LASIK. VisuMax femtosecond laser has proven to create the cornea flap with higher accuracy and precision, with thinner flap thickness than the mechanical microkeratome. Near vision surgery candidates must meet all of the following criteria. Approximately 45 years of age or older who are currently experiencing difficulty or discomfort in up-close reading and would like to be less dependent on eyeglasses. Adequate understanding of the benefits and limitations of near vision surgery. Patients will be able to see reasonably well both in the distance and up close, without needing the help of spectacles for routine daily activities. However, the vision may not be completely clear and may still require the use of spectacles on some occasions, such as driving at night or using a computer or reading for an extended period of time. After near vision surgery, it will take up to 3 months for the patients to adapt to the vision and may have some discomfort during this time. If symptoms of discomfort from monovision do not improve within 3 months after surgery, an enhancement procedure may be considered on the eye with remaining nearsightedness. At TRSC, less than 1% of patients need an enhancement procedure. After the enhancement procedure, the patient will have to wear spectacles for reading, just like a person with normal vision who is affected with age-related farsightedness. About 10% of patients with any under or overcorrection may need an enhancement procedure for fine-tuning the vision after near vision surgery. When you come in for the pre-operative eye exam, we will simulate NV LASIK vision for you, both distance and near, through the use of trial glasses at the clinic, and our doctor will advise for you to wear glasses or a trial contact lens for about 1 week to simulate the surgery before making a decision whether NV LASIK is suitable for you. Success rates after near vision surgery. A current TRSC survey shows that approximately 97% of patients were happy with the decision to undergo this procedure, with 93% being glasses-free overall. The survey included questions of visual functionality, such as reading the newspaper, menus, price tags, computer work, driving, etc. Some facts about near vision surgery. About 6% of all patients need glasses for night driving. About 16% of all patients need glasses for very detailed tasks, such as sewing or small crafts. Adapting to monovision. During the first week after NV LASIK, some people go through an adjustment period. There may be some problems with both distance and near vision, for example, not being able to read at all, or reading for long times and experiencing eye fatigue. The ophthalmologist may decide to prescribe a pair of temporary spectacles to be used until the eyes have fully adjusted. The lenses of the spectacles may need to be changed a few times, especially in the first 3 months, because the eyes are still adjusting to the surgery and need time to adapt. Some patients may have double vision, dizziness, nausea, or experience eye pain. All these symptoms will affect a NV LASIK patient in the early stages. Once the body has the time to adjust, these symptoms should gradually decrease.
Once you decide to undergo LASIK surgery, naturally, you will expect the best treatment results. It is important for you to know that a high success rate doesn't necessarily mean you'll never need to wear eyeglasses or contact lenses again. You must always think that there is a possibility that you may still need them on some occasions. For example, while reading or driving, especially at nighttime when glasses may have to be worn.
Limitations of laser vision correction treatment. 1. Limitation of the retina. It is built to have different capacities in each person and each eye. Laser vision correction surgery cannot increase the retina's capability to receive focused images. Unaided vision after surgery will be partially limited by the level of vision that the patient achieved when wearing the best spectacles or contact lenses before the surgery. 2. Laser vision correction surgery is a surgical procedure that corrects only nearsightedness, farsightedness, and astigmatism. They cannot treat, prevent, or cure any eye disease or abnormalities. 3. Even with successful laser vision correction treatment, the eye's inner structure will still remain the same and will consequently still be prone to the same risks as before. You will still have a chance of developing other eye diseases. 4. Your eyes will change naturally by age and will continue to develop some eye diseases that come with age, such as cataract, which cannot be prevented by laser vision correction surgery. 5. People who suffer from refractive problems are more at risk of becoming affected by various eye diseases, such as glaucoma, retinal diseases, and dry eyes. Periodic eye checkups and preventative screenings are the best way to ensure that your eyes remain healthy throughout your lifetime. Surgical complications can be categorized as follows: intraoperative complications, post-operative complications. Intraoperative complications. Intraoperative complications are very rare, including an abrasion of the external surface of the cornea or incomplete corneal flap creation. Postoperative complications. DLK, diffuse lamellar keratitis. Cause. Diffuse lamellar keratitis, or DLK, is a unique and relatively rare post-procedure condition following LASIK surgery. It is unknown what causes DLK. A number of names, including sands of the Sahara, have been used to describe this condition. It occurs when accumulation of inflammatory cells develop under the corneal flap. This condition usually occurs within the first week after LASIK surgery, although we have seen few cases occurring few months after LASIK surgery. In most cases, patients do not experience any noticeable symptoms related to DLK. Because of this, most cases of DLK can only be detected with a doctor's exam. Symptoms. The patients usually do not have any symptoms, and DLK can only be detected by a doctor's examination. For severe cases, patients often exhibit pain, foreign body sensation, photophobia, and blurry vision. Treatment. Depending on severity, therapies may range from topical or oral anti-inflammatory to irrigation and surgical repair. Infection. Cause. Most cases of eye infection after laser vision correction surgery are caused by the eye's own native bacteria found on the eyelids, lid edges and lashes, connective tissue, cornea, and tear canals. When? Eye infection mostly appears early, within the first week after surgery. In rare cases, it can manifest later. Symptoms: pain, itching, or sensation of a foreign body in the eye, having eye redness and discharge of yellow pus that may be crusty on waking up, loss of vision. Prevention and treatment. Despite the low possibility of occurrence, we take every precaution to prevent infection, both during surgery and after surgery. We thoroughly disinfect our operating rooms to create a sterile environment and prescribe antibiotic drops for all of our patients. Patients are also forbidden from letting their eye come into contact with water for 1 week. If an infection ever were to occur, antibiotics would be administered, a normally effective means of treating this condition without resulting in any loss of vision. The chance of infection after 1 week will be the same as patients without surgery. Epithelial ingrowth. Cause. It is possible for cells from the protective layer of the cornea to enter the incision area. The chance of this occurring is less than 1%, with increased risk when a corneal abrasion occurs during the process of cutting the cornea or after LASIK enhancement procedure. Symptoms. Epithelial ingrowth is usually asymptomatic if it is very minimal. Patients may have decreased vision, dryness or foreign body sensation, light sensitivity, glare and halos. Prevention and treatment. If only a few cells penetrate the incision area, they pose no danger and can be safely left alone with no treatment. If there are many, visual quality could be affected. This problem will be resolved by lifting the flap and removing these cells with no effect on the final visual outcome. Subconjunctival hemorrhage. Subconjunctival hemorrhage may occur secondary to the suction ring that is placed on the eye. This certainly is not a serious condition and merely presents as a bloodshot eye on the first post-operative day. If this happens, the subconjunctival hemorrhage will normally clear over the next couple of weeks and is of no visual consequence. Side effects. Dry eye. Eye dryness can be caused by laser vision correction when the surgical procedure disturbs the corneal nerves that stimulate tear secretion. When the patients can have difficulty opening the eyes, having red eyes and eye irritation, like sand in the eyes. especially after long use, and can result in blurry vision. In some patients, this problem may last from up to 1 to 3 months. Treatment. The patient will need to continue using artificial teardrops on a regular basis. Frequent breaks are also recommended. Eye pain, eye strain, and headache. These symptoms may be caused by the eye focusing muscle, as the vision is not sharp during the adjusting period 1 to 3 months after surgery. Patients may have symptoms of eye pain, eye strain, or headache that may spread to the neck. Treatment and prevention. Try to rest your eyes every 10 to 20 minutes by looking away or closing your eyes for 10 to 20 seconds. Do not focus on anything to relax the eye muscles. Then you can return to using your vision again. Low light vision problem. In the initial stages of healing after laser vision correction surgery, patients can experience low light vision problems, including glares and halos. The patients can also feel that their eye's ability to adapt to sudden darkness when changing from a brighter to a darker environment has decreased. For example, when driving into a parking garage or walking into a cinema, light scattering can be observed as light rays or halos surrounding a point of light. This will generally occur in the dark, especially on dimly lit streets at night. They are not common in a well-lit place or during the daytime. Cause. The cause of glares and halos can be from corneal curvature after surgery. The refraction of light is not organized, especially in low light. The size of your pupils can be another cause of glares and halos. When in low light conditions, if a patient's pupils dilate beyond the area of the cornea that the laser had treated during surgery, it can cause glares and halos. When? In the initial stages of recovery from laser vision correction treatment, it is more common to experience glares or halos. This will gradually decrease during the first 6 months after the surgery. If the condition still persists after this period, then it can be considered permanent. There is a 1% probability of light scattering becoming permanent. Treatment. Permanent light scattering will affect visual quality only in dimly lit places. This condition can be improved with the following possible solutions. Use of special glasses or anti-glare glasses. By administering pilocarpine or alpha-GAN eye drops to prevent dilation of the iris in dark surroundings about 30 minutes before driving. Increasing ambient lighting, such as turning on the light in the cabin while driving. In some cases, the condition can be corrected with the additional laser vision correction surgery. Corneal haze causes the cornea to have diminished clarity and results from a direct reaction of the eye tissue to the healing process after surgery. Cause. Corneal haze tends to be caused by an aggressive wound response after laser vision correction surgery. In response to the wound of laser vision correction surgery ablation, the cornea can become clouded with white cells. When? During 1 to 3 months after surgery, corneal haze is commonly visible upon examination by a doctor, especially in PRK surgery. Haze may or may not affect vision. Treatment. From past surgery results at TRSC International LASIK Center, we have not yet encountered significant corneal haze resulting in decreased visual clarity. If corneal haze were ever to result in poorer vision, it is treated by using the same laser to erase the haze tissue, using medication, or finally by partial transplantation of the cornea. Residual refractive errors. Cause. Overcorrection or undercorrection is a residual refractive error remaining after surgery, which could be temporary or permanent. They are typically due to variances in how a person's eyes heal after surgery. How your eyes respond to laser energy and how they heal after surgery play an important role in whether or not you achieve the visual outcome you desire after surgery. Overcorrection and undercorrection is more common with high prescriptions. When? During the 1 to 3 months after surgery. Symptom: unclear vision. Treatment: your eye doctor can advise and explain your risk of an enhancement surgery based on your pre-operative prescription and other factors. In most cases, these undesired outcomes can be corrected with a follow-up refractive surgery called an enhancement. The enhancement procedures are usually performed approximately 3 months after the initial surgery, after your eyes have completely stabilized. Solutions to the problems mentioned above may not be able to solve the problems for all patients. In summary, all possible side effects are lower than 1% in LASIK or femto-LASIK.
Please take some time to read the consent form for undergoing surgery. Consider it very carefully before you decide whether to undergo surgery. This is meant to give you a clear understanding and realistic expectations. If you have any questions regarding the content in the consent form, please address them directly to the ophthalmologist in charge at the end of today's examination. Thank you for choosing and trusting TRSC to take care of your vision today.